Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on October 22nd. Today, we have with us Nita Ludwig, the administrator of the Rock Island County Health Department, and Edward Rivers, the director of the Scott County Health Department. We also have two contact tracers with us. We have Leah from Scott County, and we have Debbie Freiberg from Rock Island County. Nita, let's start off with the Rock Island County numbers, please.
Good afternoon. Today we are reporting one new death in Rock Island County of a man in his 80s who had passed away at home. The staff and everyone here at the Rock Island County Health Department offer our deepest sympathy to this person's family and friends. Our deaths are now at 98 for Rock Island County due to COVID-19. We do additionally have 53 new cases of COVID-19 today, which brings our total to 3,939 total cases, and 29 people are currently hospitalized in Rock Island County.
Thank you, Nita. Ed?
In Scott County, the number of cases stands at 4,172, and our deaths remain at 37. From the beginning of the pandemic, a strong focus has been placed on the data that describes the spread of COVID-19. Data is compiled on positive cases, countywide positivity, deaths, long-term care outbreaks, hospital beds, ventilators, and many other data points. However, numbers alone don't provide us a full picture of the pandemic in our community. Much of the information we gather is through interviews conducted with individuals who have tested positive, as well as their close contacts. We're able to interview more than 95% of cases reported in our county and the contacts they each may have. Each interview helps us determine the types of symptoms people are experiencing and the interactions they're having in the community. From time to time, the interviews identify similar activities or events, indicating whether or not the public health guidance we share has been heeded. Today, Nita and I are joined by a staff member from each of our departments who participate in our contact tracing activities. We've invited them to share some information about the process and provide some insight that tells us about the spread of COVID-19 in the Quad Cities.
Thank you, Ed. We will first hear from Debbie Freiberg, who is a volunteer contact tracer and a member of the Rock Island County Board of Health.
Hi, everybody. I just would like to share with you that I've been a nurse my whole adult life. I spent most of my career working with young cancer patients. When I was a young nurse, most of the patients died, but by the time I retired, most kids recovered and were cancer-free years later. Science made this possible. I've been helping at the Rock Island County Health Department since March, doing contact tracing. Before the pandemic began, few people even knew the term contact tracing, but it really is the basis of science, proven public health infection control. Contact tracing for COVID-19 typically involves interviewing people with COVID-19 to identify everyone they had close contact with during the time they may have been infectious, notifying contacts of their potential exposure, referring contacts for testing, and then monitoring the contacts for their signs and symptoms of COVID-19. For the most part, the people I talk to have been cooperative. But I've been yelled at, I've been hung up on, I've been cussed at, and those are just the people who pick up the phone. I leave many messages that are never returned. It's hard not to feel defeated. Public health is not the enemy. We must not give in to pandemic fatigue. The people I talk to seem to not understand how their individual actions impact the entire community. We've linked dozens of cases to 2 large weddings this fall, but the state restricts weddings to 50 people, but these gatherings were such larger than that made so many people become positive. We've seen many of these cases pop up in Rock Island County of people who took a break from COVID and went into Iowa, where the positivity is 20% and safety protocols are basically non-existent. Hundreds of cases have started as a night out at a bar and spread to hundreds more. One person told me that we all knew each other, so we didn't need to wear masks. That's not safe. At least one person in that group was positive and spread it to many of their friends. I talked with a woman who went to brunch at a restaurant with 6 other friends. She hadn't been out in months and thought this would be safe. They were good and wore their masks except when they were eating and drinking. All 7 of them got sick. I talked with one man whose wife was positive and he got sick too. The day I talked to him, he said he was feeling better. I then talked to his son a couple days later as a contact. The son told me his dad had died the night before in the hospital. The family had had to say goodbye to him over the phone. We as contact tracers are not trying to invade your privacy. We are not doing this to be nosy. We're trying to control a global pandemic with the only tools we have, tracing infections and urging people to wear a mask, watch their distance, wash their hands, stay home when you're sick, and stay home when you are told that you are a contact. Until scientists find a vaccine or an effective treatment, and I believe they will, we must use the tools we have. Please help us.
Thank you, Debbie. We'll now hear from Leah Kroger of the Scott County Health Department.
Good afternoon. My name is Leah Kroger, and I assist with contact tracing for the Scott County Health Department. I'm not a nurse, and I don't possess any previous contact tracing experience. By trade, I'm a dental hygienist. While my training has provided me with a solid science background and skills in asking questions about patients' health, I was not expecting to use those skills to become a contact tracer, nor for a pandemic, to say the least. However, COVID-19 has led our department to have all hands on deck. Stopping the spread of infectious diseases is the basis of public health. The most effective tool we have is social distancing. We need to separate those who are sick from those who are not, and separate those who are around someone who is sick to ensure that they don't continue to spread the virus. Many positive cases that we interview are people who are asymptomatic, meaning they feel fine and they may have only gotten tested because they were exposed. We know COVID-19 is in our community and that masks and keeping physical distance helps reduce the spread of the virus. So when you must go out, assume that everyone that you encounter is positive. There is no normal in 2020. Sadly, COVID-19 looks like any other illness we typically encounter, especially this time of year. So when you do not feel well, it's important that you stay home. The mask and social distancing guidelines for COVID-19 exist to help you, not hinder you. That is the reason why we ask if you are wearing masks and who you are closer than 6 feet for more than 15 minutes with. These answers matter, and they help us determine when and if a quarantine is needed. So please, wear your mask and keep your distance from others outside of your household. It will make the difference. If you've tested positive for COVID-19, you will receive a call from public health. Please, please, please share your contacts with us. Reducing the spread will only work if we can identify and separate those who are exposed so that they don't unintentionally spread the virus to others. In case there are misconceptions about what it means to tell us who your contacts are, I'll explain what a contact can expect when we do give them a call. We'll introduce ourselves and let them know that they were identified as a close contact to someone who tested positive for COVID-19. We encourage people who are positive to inform their contacts and let them know that we'll be calling. We'll review the signs and symptoms to look for should they develop COVID-19 as a result of their exposure. We'll provide them with guidance regarding their 14-day quarantine and how that timeline may change if they do develop symptoms. However, the most important part of our call is that we offer to answer any questions or concerns about COVID-19 and let them know that we're always available if future questions do arrive. In a perfect world, we would call a positive case and they would tell us that they have no contacts who need to quarantine because they have been social distancing and masking. The more often this would happen, the slower the spread of the virus, and the sooner we can begin to recover from COVID-19 as a community. However, in a world we are currently living in, identifying close contacts is vital to helping us stop the spread. Lastly, remember the contact tracer that does give you a phone call is a member of your community, doing their best to keep you and your family safe. We all live in this community and care for our friends and neighbors. We get to know you during these phone calls, and we think about you and your recovery long after. We are here to help, and we are grateful for your cooperation. Thank you.
Thank you, Leah and Debbie. And Leah, sorry for mispronouncing your last name. If you want to put some questions into the chat, please go ahead. We do have one here. What are the things that you have to say over and over again while talking with people? In other words, what are people most confused about or unaware of? Debbie, would you like to answer that first?
That they have to isolate until the 2 weeks have passed from when their symptoms first started, and anybody they came in contact with actually has to quarantine for 2 weeks after they last saw the person. And we also have to reiterate that we do not know how long their immunity is, that they still need to wear a mask, socially isolate, and wash their hands carefully even after they've had COVID.
Thank you. Leah, do you have anything you'd like to add, or Ed or Nita?
I'd second what Debbie had to say. We get asked quite frequently, do we need a social distance from people that are in our household? Especially if some of those other household members tested negative. That's very common for one household member to be positive and the others, or a couple of them, to still be negative. So yes, we still want you to isolate. We still want you to finish that 14 days of quarantine because it can take up to that 14 days for symptoms to onset.
Okay, we have another question here. When we're doing the contact tracing, are we finding that people are following the instructions and complying? Leah, what are you seeing?
I would say most of our people are complying. Some are hesitant at first when we do call to identify who we are and what we're doing, but they are appreciative of the advice that we do have to say. We're working really closely with employers as well. So anyone who is positive, we reach out to employers, let them know when the case can return to work. And then even if they're students, we work with those schools to say the student is out, or if there's a household contact, the student needs to remain home to keep themselves and others safe. So I think we have great communication to kind of keep people safe and stop the spread in our community.
Thank you. This is a question to Nita and Ed. What percentage of contacts are reached, and then do you have any idea of how many people refuse to give information? Looks like
This
Ed
is Nita. Oh, I'm sorry. It looks like Ed had typed in some information in the chat. In Rock Island County, we don't have great data on that as yet. We are using a new system that the state rolled out to us in July, and they do intend to start publishing some of that information at the end of this month. Perhaps Debbie could give you a little more information on how many are reached and how many voicemails they get. But I will say, with the case counts that we've had, today 53, the last several days in the high 40s, it is difficult to keep on top of reaching all of those people on a daily basis, even with the 14 to 15 contact tracers that we've already hired in Rock Island County.
I'm going to agree with Nita that it's been very difficult to get a hold of everybody. We called them 3 times, and every day I come in, that's what I start with, the people that I haven't gotten a hold of the last few days, and then I start calling them, and then we send them a certified letter. But that takes time away from picking up new cases to get the contacts, and then again, sometimes contacts never call us back.
Another question here is how many contact tracers are in each county? Ed, would you answer that for Scott County, please?
We've had up to 19 staff doing case investigation. That number may vary from day to day, but that's the total number of staff we have trained and working. I'll add one other piece of information to my comment in the chat where, as I noted at the top, we reached 95% of the cases reported to us. As of now, we have 190 cases marked as undetermined. That includes people we were not able to reach and people who would not give us information.
Okay, thank you. Nita, how many contact tracers do we have here?
So we are adding contact tracers on as we have more and more cases. Currently, we have hired 18 additional contact tracers, and that's aside from our regular staff in infectious disease of 6. And we also have some staff in our other programs who have been trained, but again, they are currently working their other programs as well. So they don't do contact tracing each and every day.
Okay, thank you. We have a question here. This is more for Nita. With the mitigations announced for Region 1 today that include counties that are very close to Rock Island County, how worried are you for our residents here in Rock Island County, and what alarms were sounded for you?
We are concerned here in Rock Island County because, again, we have seen our cases skyrocketing over these last couple of weeks. Our positivity rate, the state is putting that on the Illinois Department of Public Health website under the regional metrics now. And the rolling positivity rate, I just looked at it a minute ago, is currently 9.1. So that's pretty high. It's over the 8% that is in the warning level. So we are definitely in a warning for that. We have had lots of hospitalizations as we've reported this week, including our high of 33 hospitalized just a couple of days ago. And so it is concerning, especially as we go into the colder weather. So that is why we are still strongly pushing the messages of wearing your mask and social distancing to try to get these numbers back down again. And we need everyone's cooperation with that.
I'd like to further note about contact tracing in Scott County. Although we have been operating with only current staff up to this point, we have placed a job solicitation for contact tracers on the county website, and we'll be hiring more in the near future.
Thank you, Ed. Nita, what is a good number to say for our total contact tracers? Like a solid number?
Yeah, I'm sorry. I was adding in my head as well. So we have hired 18 total aside from our staff. So that would be 24 with infectious disease staff and our contact tracers. And then we also have trained some staff in other programs like environmental health and family case management. So upwards of 30.
Okay, thank you. That is the end of the questions in the chat right now. We'll pause here for a couple of seconds to see if anything else pops in here. Okay, seeing none, Thank you to the contact tracers for your time, and to Ed and Nita as always. We wish everyone a good and safe weekend. We'll talk to you next week. Thank you.